Hello, everyone, and welcome to the 2021 Sizzling Summer Series, sponsored by the UNMC College of Public Health Office of Public Health Practice. We are grateful for our partners on this series, the Midwestern Public Health Training Center at the University of Iowa, Wichita State University, and the College for Public Health and Social Justice at St. Louis University. My name is Katie Brandert. I am the Manager of Workforce Development and Leadership Programs in the Office of Public Health Practice at UNMC. My colleagues and I in the office will be your hosts for this series. This summer series, our third annual, is focused on exploring what it will take to become an anti-racist public health workforce and public health system. Over the months of June, July, and August, we will host the 5-part series. And today we start at the beginning with session 1, the role of identity in health outcomes. Before I turn it over to our speaker, a few logistics. Because of the number of participants, we ask that you keep yourself muted on today's call. If you do have questions for our speaker, I will be monitoring the chat box throughout, and we encourage conversation in the chat box today. If you experience technical difficulties throughout the call, please send me a private chat for support. We are recording today's webinar, and the slides from today will be posted. Both the recordings and the slides from each of our 5 sessions in this series will be made available online following the calls on both the UNMC Office of Public Health Practice and the Midwestern Public Health Training Center websites. Also, very important, a link to the evaluation will follow this call. Evaluation data will be used to inform the content for the next call in the series, for quality improvement in the series overall, and for reporting purposes to our funders. So we thank you in advance for your feedback in that evaluation. Let's get into today's session. I want to introduce our speaker for this session, Derrick Willis. Derrick is the director of Iowa's University Center for Excellence in Developmental Disabilities at the Center for Disabilities and Development within the University of Iowa Healthcare. Derrick has been instrumental in helping lead and support the center's work in reaching underserved populations and plays a key role in diversity efforts across campus. Previously, Derrick served as a director of a similar center at the University of Missouri, Kansas City. His background includes 32 years of experience working at local not-for-profits, state government, and higher education. Most of his career has centered on working with youth and families from diverse backgrounds living in urban communities. He brings a wealth of experience in mental health, substance and alcohol abuse treatment and prevention, violence prevention, education transition, employment, and the topic for today, cultural competency and anti-racism. Derrick, we are very grateful that you are here today sharing your expertise and experience with us. Over to you.
Thank you so much for the introduction, and thank you all for being here and being interested in this topic. I just want to first say it is an honor. It's a pleasure. First of all, if Laura Walkner asked me to do anything, I don't say no. She is has proven to be a strong partner, somebody that I respect tremendously. The work that they do out of the center. You know, the Midwest Public Health Training Center, and just the work that we do together. I did a presentation on moving from safe spaces to brave spaces, and kind of touched on some of these issues here. And then when she asked me to do this, I was honored and you know, happy to help in any kind of way. What you'll find. And I also want to say that I'm pleased and you know, just excited about the fact that this whole training series is focusing on some issues that, you know, through, you know, some of the things that we experienced over the past year, shed light on a lot of our systems, a lot of our structures, and the fact that we are doing a series. I looked at some of the other trainings on micro and macro aggressions and implicit bias, and, you know, structural versus individual inequities, just that we have something that is focusing on an equity framework, and it is dedicated a whole series to that is impressive. And I commend all of those who were involved in pulling this together. And having these types of opportunities to come together, I think, you know, what we experienced over the last couple of years, you know, it's taught us how to, you know, to be truthful about a lot of things that we are seeing. And it also, it forced us to see things, you know, as a social scientist, I'm amazed at, you know, just what a lot of people are saying, the awakening and how people are woke now. And I'm just amazed at how, you know, things evolve and translate, particularly events and how they spark movements. And so I this past couple of years with COVID and all the civil and social unrest, and the people who are not only seeking to understand and to gain more information and knowledge about what we are experiencing and what other people are experiencing, and then not only gaining the knowledge, but actually putting knowledge into action and translating that into changes is powerful to see. And I'm a person who has been in this work since 2000. You know, I started my career in 1985, and most of some of you on the phone call wasn't even born then or thought of, but I started my career then, but I really didn't get engaged into this work. Although in a sense, I thought I really was working on social justice issues and things related to it. But when I took a position as a direct service provider at a local nonprofit organization that took kids that have been abused and neglected, I didn't know that I was working on social justice issues. I didn't know that I was working on this whole identity stuff and working on cultural stuff that's related that brings about, you know, differences and exposes differences. But so I, you know, I didn't dive into this work until deep into like the year 2000. And so over 20 years of just examining this, I still don't consider myself an expert. So I want to be clear on that. I don't think that there's any person that is an expert in this work. And I don't, you'll never hear me use the term culturally competent. I don't think that we're ever competent in culture. It is ongoing, it's a journey, as my friend Tawara Good at Georgetown's National Center for Cultural Competency says, it's a journey. And you have different places and different stops. But, you know, I again, just for an organization and for a system, and particularly the health system, because, you know, what was exposed during this pandemic, you know, it brought on for me a newfound sense of respect for people who are in the health industry, and so I commend all of you who are in this field. I commend all of you who are on this call, who are looking and seeking ways and knowledge in terms of how do we begin to set up responsive systems. You'll hear me talk about that. I'd rather say responsive than culturally competent, because I think that we need to be striving to make sure that we are responding to the needs of everybody that comes through our door for whatever services that they are seeking, or whatever ways that we're interacting with them. And so for me, it's more about developing responsiveness and addressing those issues. Just a little bit about my journey. You know, I said I began this work in 2000. It was with the Department of Mental Health at the state of Missouri. I was asked to lead an Office of Multicultural Affairs by the then director, Dr. Roy Wilson, who was doing some work at the national level. And that's when you started seeing grants coming out and everything that was coming from the federal agency saying that it must be culturally competent and it must be done in a culturally responsive way. And we used these terms, but nobody knew what that meant, you know. And so I was given the charge of trying to develop a system. One of the largest health systems in the state of Missouri, 11,000 employees with 7 HAB centers all across the state, which I'm grateful that a lot of those don't exist anymore and that we're doing more community-based stuff. But my task was to help this system become more what they call culturally competent, and you know, so I have a lot of lessons learned throughout the journey and everything. But I'll stop and I just want you to know a little bit about, you know, my background and what gives me the idea that I can even present something like this. And I have to say too, identity is something that you know, my work is more centered on cultural responsiveness. Identity is a part of that, as you will see in the way that I've designed this, is that it shows you how identity is connected to culture. Identity is connected to stereotypes and biases, and what we can do to begin to start breaking down some of those things. And so I'm not an expert in identity. I did do some research in preparing for this, and I was aware of the works of Erikson and his psychosocial theories as it relates to identity. The most profound body of work that discusses identity, and historical work that still has prevalence today, right? And so I will discuss that. So just what I'd like to accomplish today is just kind of talking about how identity is formed, discussing, you know, the social and the cultural constructs that are associated with identity, exploring some of the theories. I'll mainly focus on Erikson's work, and then also Turner, Toffel and Turner's work as it relates to social identity, and not get too heavy into that, but then most importantly, discuss ways that I think that we can move forward in terms of being responsive to what is presented there. So I'll start with this, and then as Katie said, I encourage you to, you know, I want this to be as much of a dialogue as it can, you know, knowing that we're in this, you know, Zoom world, and I can't see everybody. You know, we're not in person, but anytime I do a presentation, I welcome more of a discussion and more of a feedback. I don't care if I don't get through all of my slides. You're gonna have all these slides. I'd rather have some discussions and thoughts, provoking ideas being shared than to just go through each of the slides. And I don't, when I present, I try not to just read the slides. So identity, I wanted to just really kind of just get a framework of where we are when we talk about identity. It's our sense of self. You know, when you think about identity, it's how you see yourself, how others see you, and the way that we interact with others. So just to give some definitions that really kind of speak to it. You know, if you look at Wikipedia and you look up identity, it talks about, you know, these qualities, these beliefs, personality, even looks and expression that make up a person or a group. Oxford Languages talks about the fact of being who or what a person or thing is, and identity. And then Webster, you know, distinguishing character and personality of an individual, the distinguishing character and the personality of an individual or individuality, right? And so just to give a framework of, you know, when I'm talking about identity, what do I mean? I have a friend who is at the, actually was just identified as the director of NIDLR. Her name is Anjali Forber Pratt, person with a disability, and she's done the most profound work on disability identity. What you'll find when you talk about identities, it's connected to many different things, you know, so you have, you know, ethnic identity, you know, you'll have, you know, identity related to like who you are, you have gender identity, you know, your preference in terms of sexual orientation. So she defined this, and for those of you who don't know, NIDLR is the National Institute on Disability, Independent Living, and Rehabilitation Research. She's appointed by President Biden to lead that It's a presidential appointment, and such an honor to have people with disabilities in leadership positions. But anyway, I really like what she defines. She's done the most work as it relates to disability identity. And she says it's a compilation of integrated, fluid identities based on contexts like gender, culture, ethnicity, your orientation sexually, socioeconomic status, disabilities, and countless others. And so identity, is just not one thing. And identity is fluid, and it depends on where you are and in what frame of conversations you are and in places that you are. And so when I think of identity, it fluctuates. It's kind of hard to pinpoint, actually. And if I ask you the question, how would you identify? What is your identity? It would be all over the place, because some people look at it from the ethnic side of it. Some people look at it from the gender side. Some people, you see people using the pronouns, that's a part of their identity now, and so it's all over the place. And so it is fluid, and we have to be respectful of how people identify, basically, just like in being responsive to any kind of things that are brought for us, It's also when we interact with others who are like us, we learn about our identities through the mirroring, modeling, and recognition. And so, as you'll see when you go through Erikson's stages, the first stage is like, it's really about mirroring. Our identity is developed, as we start forming it, it's developed by the people that are around us, right? And so that's the importance of really trying to work with people as early as we can in terms of just making sure that they're in awesome environments that allow them to grow and succeed. And I have a friend that's in early childhood education, and we talk about this all the time, that the importance of those birth to 3 years of age and how that impacts and how some people struggle the rest of their lives if it's not a solid foundation, if it's filled with trauma, how people respond to that. And so identity, it's an intact identity formed in partnership with others, and it's also it's critical, for leading a healthy life, both psychologically and physically. And I was from my good friend Angelique. And I love that. I also wanted to just, put together some thoughts for myself too. I think identity is, like I said, it's ambiguous. It's a slippery term. Again, hard to define. It has so many variables and so many variations, and so that's what makes it slippery. Because when you speak in, like, for example, I can identify as an African-American male. I can identify as a person who was born in the 60s. I can identify as a person who was born in the South. I can identify as a scholar. I have an academic appointment. I teach classes, seminars. I do trainings like this here. I mean, I can identify myself as a professional. And so it is slippery. It is, we have multiple identities, and it's something that is unique to all of us, but also, it implies a broader relationship with others and stuff. Again, identity can change in terms of your circumstances. You have a professional identity, you have a personal identity, you have, ethnic identity. And so it also is, again, fluid and ambiguous, and also, a slippery term. I think it's important to point out, a distinction between the self-identity, and that's how we see ourselves, right? And then the social identity is what is constructed by others and may differ from our own identity. I'm a former basketball player, and if you ask me, I was one of the greatest players that ever lived, right? And I just had in my mind I was going to be a D1 player, but when the scholarship offers start coming, there was none from D1, and so my self-identity, the way I saw myself, it also bumped up against what society or others who were in that field saw me and constructed me, and so it will differ, and typically people categorize individuals according to these broadly socially defined labels, and then we'll talk a little bit about that, dark skin, light skin, and I think it's just a way that when society begins to start putting us in these socially defined labels, it's just a way of seeking understanding, seeking the ability to make sense of what we see. We strive for knowledge, we strive for understanding, we strive for the ability to know, So that was just identity and just kind of laying the framework for identity. I want to get into just a few theories. I don't want to get too deep into this and be more of a of a lecture that I have with students and everything, but just laying some framework. Again, I think Erikson's work on psychosocial theory really is the most profound work that has been done, that kind of looks at identity and looks at how that influences, impacts, and interacts as well. He was one of the first to propose that it's a lifespan model, so something that, you don't just establish and then you just walk away from it. It's something that's constantly evolving. It's something that constantly is changing. But he did try to break it down into some successive psychosocial stages, and he has his broken down into 8. And there's others that looked at that and added things to that along the way. Again, he receives most of the credit for recognizing the influence of culture on the development of identity, and he believed that an individual cannot be understood apart from his social context. And so all of these things are woven in together. And so how do you, number one, take how you see yourself, but also how others see you as well? And that compilation just kind of puts together what we consider identity. Talks upon, as the development of it, identity, we really kind of look at, as I mentioned before, how your parents see you, how your parents present to you, how the people that are around you. I can't say parents now, because when I grew up, there was not a lot of daycares, and if your parents worked, I was over at a relative's house, and I also had the people who were in my community and the neighborhoods that I was from. There just wasn't these early childhood education centers that they are now, and so a lot of what we know and where our identity was developed came from the people who were around us and who we spent the most time with, and that still holds true today. And I think that there is, it's just the way it's developed, and hopefully, young people are put in an environment. And most of the time, when you're looking for an early childhood education center, you're testing that and you're checking out to make sure who are the people that are going to be touching the lives of your most valuable possession, your loved one, your child, and because that a lot of this begins with this formation of development and identity based on who you spend the most time with. Then what happens is, you begin to go beyond your home, and then you begin to interact with others. And so that's when you begin to also not only see how your people who are your loved ones see, but also how others begin to identify you. And then I think one of the most one of the most important phases of identity is developed in the adolescent stage, in those middle school age. I don't know. I mean, I don't know if you've been to a middle school in the past 2 to 3 years. I'm raising a grandson, and he's in the 9th grade now. But when I went to the middle school, I just said, God bless those people who are working with kids at the middle school age, because all types of things is formulating at that time. And I think that's one of the most critical stages of identity, because that's when, number one, kids really become brutally honest and are searching for who I am, where I fit, what is my place in this world, and a sense of belonging, and a sense of direction in your life, even though, it is time specific. It's a meaningful time. And again, as Erikson has taught us, that identity development does not end with the formation of it, and that it's an ongoing process. And as you matriculate through a lifespan, it changes, you change, the way people see you change, and the way we socialize changes as well. So those early stages of development, again, are important. I did want to just touch on like what and how I would say I was going to use the term confusing, but it's not. It's complex. I would just say complex. And so if you just took an example of a 15-year-old, and we identified a girl on this one here, but and so you'll see how identity kind of shifts in different environments. And so when you're in the classroom, there's a certain expectation, and not all people abide by this, of course, but you would hope that they're serious in the classroom, they're respectful, responsible, cooperative, those kind of things. And then you shift to, when they're with a group of girls, and then, it kind of gets a little bit wilder than, they're talkative, cheerful, assertive, playing, outgoing. And when they're best friend, it narrows down a little bit more. They're more comfortable, they're sharing more intimate things. They're able to be themselves, and so they can be moody and not worry about their friend never walking away or not accepting them. Sometimes it's quietness as well. And then shifting from mother to father, and then a romantic relation. So you look at this and you just say, wow, man, it's a lot happening at that age, right? and it's all about this formation of who I am. And that formation is also determined on how people receive me as well and stuff. And so just wanted to give you an example of just identity and how complex it is and can be in certain areas as well. So I also wanted to add on to that, just the work of social identity theory. So I felt like Erikson's work set a nice framework, but this piece of work focused on social identity more. And this is Tafel and also Turner. I didn't put that in there, but this is a body of work that took place really around the late 70s, that really kind of start looking at the work of Erikson, but also talking about group membership. And social identity considers how group membership is incorporated into our self-concept, and how it affects our views of other members and our views on non-members. And so this whole social component begins to come in. And so it's like, again, how we self-identify, and now how others begin to influence how we identify begins to come in play. And so on social identity group, it is about groups of people the groups in which people belong to are an important self important source of who we are as a person, our pride, our self-esteem. These groups also give us a sense of identity, sense of belonging in this world. And so it just starts to point out how even and the role that society plays on identity and how people present. Social identity is also to increase our self-image. It enhances the status of our group, and so how it begins to be more of a group process. And so, it begins to start looking at not only those who are in your group, but also seeking to identify those who are not in your group. And through a natural process, you begin to seek things that make you in group, and also seek the things that put you as out group. And so this is in turn which some things we see are developed in terms of just sexism. We're different because of our gender. We're stronger. There's opinions that come with this identity as well, and racism is something that sits in there. A lot of the isms come in this social identity theory, because you begin to start seeing differences and you begin to recognize those differences. And it doesn't mean that you act upon that. But a big part of social identity theory is stereotyping, and it's a normal process. We do this when we're grouping things together, and we're starting to look at the differences between groups and also the similarities. And then as Tafel begins to start talking about this social identity theory, he starts saying that we see people as an in group, and those who are different than others, we see them as an out group. And so we begin to start developing opinions, and that's where these attitudes come from. That's where certain prejudice come from. It's not saying that that's good or bad. It's just saying that this is the group that I identify with, and this is the group who we are. We know that we're different, and if you're not a part of this group, you're a part of this out group. And so we start structuring ourselves, our identity. We start hanging out with people who share similar beliefs. Again, I mentioned that I played sports early on, and so my identity, basketball and football became my identity. I became an athlete, right? And so I began to start hanging out with groups and we always had, growing up, those who we called athletes, we call them the jocks, and then those who smoke cigarettes or smoke weed or whatever, we call them the freaks, and so we have the jocks and the freaks, right? And so we began to start formulating opinions about each other, and the athletes, they always thought that they were better and more superior, and the guys who we call, and the girls who we call the freaks, were those who were thinking outside the box. They didn't value the structure and the rules and the things that we did, and so they were considered our group. So we started formulating these opinions, and that's how these stereotypes and these things begin to shape and formulate outcomes as well. And so in the social identity theory, there's three main mental processes involved. And so it's just the categorizing. Like I said, we categorize in groups. We're a group of athletics. We self-identified. We adopted that group, that we belong to, and then we begin to compare. Once we have categorized ourselves, we tend to compare ourselves with the other groups. And our esteem, our self-esteem is established within this. I think it's, a reason when I worked in Kansas City and eventually worked at an alternative education center in the early 80s. And actually it was the late 80s where, a lot of the gang violence just exploded in the communities that I was working in. And a lot of it came from this wanting to belong, this needing to belong to something, needing to be a part of a group. And that made them feel like they were somebody, even though people were telling them they were nobody. They began to have power. They began to be able to recognize they dressed red or blue. They were either Crip or Blood. But anyway, it gave them that identity, and it gave them that power. It gave them that self-esteem. It gave them things that they were needing in terms of their identity. I think comparison comes in here again. That's just a natural thing that we as people do. We compare ourselves and groups with others, seeing either favoritism or a bias towards the group in which we belong. Our team is better, or my gang is better, or my neighborhood is better, or my school is better. Looking at the University of Nebraska, University of Iowa, I don't know. but we always make the comparisons, and that's just a part of the natural process too. People divide themselves into social groups and subcultures, and that begins to happen. You start, this begins to bring in that whole conversation around culture, what you adopt, what you adapt to, what you adopt as your being, as who you are, and then you start hanging around with people who kind of dress similar, or like the same type of music, have the same interests, whether it is, sports related, whether it is arts related, whether it is, you pick it. And I mean, that's how you start formalizing these subcultures, and that's how you start formalizing entities and groups. And there's nothing wrong with that. That's the way it's supposed to be. You do want to hang out. The problem comes in is when we start comparing and start showing and acting as if, this group is better than the other. And that's where you begin to start seeing that areas of prejudice, areas of racism, areas of discrimination, and all of those things. Again, social identity can be applied to your age. I identify as a African American that was born in the 60s, and my identity is based on some of my experiences. I remember, the civil unrest that was taking place in the 60s. I wasn't old enough to fully understand it, but I remember what my house felt like when Martin Luther King was killed. I remember when assassinated. I remember when the president was assassinated and how our house felt, and just the impact that had on our lives, and just the way we socialize. I'm also born in the South. I'm not considered completely South. My folks from Arkansas, a lot of people call that the South. It's not the dirty South like I hear some people talk about, but it is Southern. And then we moved to Missouri, so we're in the Midwest, but still had Southern beliefs, and came from segregated communities, born on the north side of town, and there was tags attached to that. There was a social identity attached to that. Anybody born on the north side, and people told their kids, don't go on the north side. Nothing good comes out of the north side, And so you begin to see these identities being formed just by location, and in the families. Families have history, and your class, are you working class, or are you a part of a wealthy family? All of those things kind of have identity. Your ability to access things, the ability to see things more, influences your life and your ability and your outlook on things. And so class plays a major factor. And so all of this stuff plays into our social identity. And then it helps us begin to form correlations, and so I would argue that stereotypes are a result of illusionary correlations. Illusionary correlations is, how people see things, relationships between two variables. It's no evidence that proves that correlation exists, but it starts to formulate based on these illusionary correlations. And so when you think about women, for example, and you say, well, women aren't good at math, or you think about athletics, and you say, well, a lot of people of color are just superior athletes. You look at the NBA and you look at the number of minority players that are on an NBA team compared to non-minority players, so you start beginning to develop these correlations that begin to formulate these biases. And so, we as humans look for evidence and examples that defend our beliefs and ignore the evidence and examples that don't fit. And so we start formulating opinions, we start formulating thoughts about in-group, out-group, and it just kind of leads to, where we begin to see the formation of, difference, but that difference is not a bad thing, because that's just normal, but it's just how you respond to that difference and stuff, And so when you start talking about social cognition, it deals with the way people perceive and think about themselves and others, how people process information about their group, and which they would call the in-group, who we are, and those who are not like us, the outside group. And then ethnic and cultural identity forms as core of, conceptual frameworks like self-definition and group membership, And so I hope, what you'll see is how we begin to start moving into this category in which identity then forms, things like it identifies and it helps people put themselves in places, and like I said, the in-group, out-group, but it also creates these opportunities for discrimination, prejudice, racism, and those things. And again, racism does not require the presence of malice. It only requires the presence of bias and ignorance, willful or otherwise. And so I'm not saying that because you are different and that you look at people in a different way, that doesn't make you a racist. But it is when your actions and your beliefs lead to the way that you treat an individual, whether favorable or non-favorable. It is how that plays out. I saw this out of a gentleman out of the New York Times editorial, and I liked it. I wanted to put it in here. He said, racism is interpersonal, it's structural, it is current, it's historical. Some of it is implicit, some of it is explicit, some of it is articulated, and some of it is silence. And I have to say, and I'll use myself as an example. In growing up, as my identity was being established by the social constructs, and I saw the way that, when people would classify me, when they look at me, they saw me as an African American or a Black, what we used to say back in the day. They formulated opinions about me, and so they treated me and put me in an identity in a box that they could, recognize and frame. And so, in the way that I was treated, simply because of the color of my skin, with them not even having a chance to know me or to interact with me or to see who I was, I had an identity placed on me. You're from the North Side. Nothing come from the North Side is good. And so So I grew up with a lot of hate. I grew up with a lot of racism, because how do you treat somebody good who treats you bad? You know, how do you begin to walk away from that, and how do you begin to peel back some of that stuff that was embedded in you just simply because of who you are? And what I learned was that everybody doesn't think the same. Everybody, just because they appear a certain way, that their identity, once I get to know them, their identity really defines who they were. And so for me, moving from I hate all white people because I know the way white people treat me, and then moving from let me find out who they are, because I started meeting people who didn't look like me, who wasn't a part of my race, but were very nice and were very helpful and had resources that I needed and to help me get to where I wanted to go. And so how could I be a racist towards that simply because of the color of their skin? You know, and so it kind of really started helping me unpack a lot of ugly stuff based on, you know, my experiences in that small community that had this belief and this attitude about in groups and out groups, you know. And so that's how you know, this identity stuff starts developing in ways that can be harmful and impact the way we see individuals, the way we treat individuals, the way we provide resources to individuals, etc. And so I just wanted to also bring a couple of things to light before I begin to shift off of, you know, identity and these theories as it relates to this. There's also intergroup stereotypes as well. And so in-group favoritism is present. For example, you know, for many years, and it probably still exists to some degree. A lot has changed, but in the African American community, and for those who identify as African American, you know, please speak to this. But it was almost known that if you were light-skinned, that you were treated more favorably than you were if you were dark-skinned. And the darker the pigment of your skin, the more, you know, you are subject to being teased, subject to being ostracized and called, you know. But it was more favorable to be more like the mainstream population. So if you had long curly hair and as opposed to short kinky hair, all of that, there's these intergroup stereotypes and favoritisms that exist as well. I also want to point out that, you know, in a social psychological theory, it suggests that, you know, in order to address these issues, you know, it takes increased contact, you know, less under many, if you don't have the ability to connect and to have contact and, you know, provide opportunities to grow and to learn, you know, this increased contact can help break down some of those stereotypes. It can improve perceptions. And I love this crystallization hypothesis. It says increased contact, you know, sharpens the intergroup perceptions. And so the more you are around somebody, the more you crystallize your thoughts. And when I think about crystallization, I think about sharpening, and it increases your ability to understand. It increases your ability to relate to the perceptions of groups and stuff. And so I just wanted to point these things out. And then I have one more slide that really kind of touches on, you know, how actually I have two more that really kind of touch on this whole concept of how we begin to see, you know, identity, the formations of groups, and how that begins to interface with ethnicity and culture. And so as you begin to start identifying in groups and out groups, that's really what I think is culture. You begin to lean towards the people who are doing the things that, you know, are similar to what your interests are, similar to how society has defined who you are, and you begin to develop and be around people who are like you. And so culture is an integrated system of learned behaviors and patterns, right? And so it's not something that you were born with in terms of ethnicity. It is more about your learned behavior patterns and then how you choose to identify with society, or what group you choose to identify as you interact with society. And culture also is referred to a total way of life of a particular group of people. You know, you have, you know, the hip hop culture, or a few years ago, you know, I got into playing golf, and, you know, just changed the way I even dress and the clothes that I wear. And they even define that when you go to a golf course, right? They say no cutoff shorts, and you have your shirts have to have a collar on it and all that, you know. And so I got into this golf culture, and then a few more years later, then I bought a Harley, and then when I ride, I look a certain way, you know. I have a bandana on, you know, and I have sunglasses to keep the bugs out of my eyes, and I usually dress in jeans or some materials that are good for riding, you know. And I now become a part of this biker culture, you know, and I go to Bike Fest and all that, and it's similar, you know. But, you know, it's a total way of life for a particular group of people. And again, it includes the way, you know, the way that group of people think, says, and, you know, what they do, and it identifies a system, so to speak. But I also will add, you know, as we think about culture and we think about ethnicity, you know, we try to again rely on what we see, and I think you know, one of the things that you have to be careful about when you start looking at ethnic identity and things like gender identities and all of that, is that the eyes can fool you, and you know, we've gotten to a point in society and in the world that you can't trust your eyes all the time, right? And so, for example, I live in Iowa City, and if you think of the African population, you know, there's African Americans, but then there's also people of African descent that are from Congo, and then there's from Somalia, and then so if you really just look from using your eyes, you would say, well, that's a black person, or that's an African American, but they're not, you know. But when you dig down into it and you're looking at identity, you know, you see that there's differences there. There's even differences of people who are African American. For example, I'm a African American who come from the South, but I'm here on an academic appointment and because of my working in the university. And so the way I arrived was different. And so you have African Americans who were born and raised in Iowa. They have a different approach, a different identity, a different outlook as I do, and they look at me differently, right? And it's the same way with the individuals from Congo or Somalia. They look at us as different, even though some people might look at us and say that that's a black person. But when you start digging deeper into it, you'll see that there's differences in the way that they interact. The way we interact is even different. And so here, and then you also throw in location too. So I also feel like in Iowa City, you have people who have I call them immigrants from Chicago, people who have chose the field of dreams, they call it, and that got out of the city, that came here, and they came here for a better life. They're not trying to interact with people and make friends with people. They're just trying to to live a better life and get out of the life that they were in. And so right here you have 5 sets of groups of people who are, if to the eye, they're Black people. But when you start peeling back into it, they're Black people that look at the world in a totally different way, and their identities are different, even though we have categorized them as an ethnic identity. And when you think about ethnicity, I think you always have to think about these concepts that are up here of assimilation and you know, how marginalized they recognize themselves, and some of them who choose to be separate, and then some of them who choose bicultural. And I think biculturalism takes place a lot, particularly with minorities, is that, you know, a lot of times we are part of the mainstream, but we also, then we go back to a community or go back to our friends, or we go back to our family, and we go back to our minority culture. And so we fluctuate in and out of cultures, and are bicultural, so to speak. And so just thinking about all of these things that really kind of begin to impact the individual, how the individual is perceived, how the individual's identity is developed, and what that does in terms of the formation, and then how we interact with that. And so I spent 23 slides on really just kind of digging deep into this whole concept of identity formation, looking at some theories as it relates to that. And I just want to take a break and just pause for a minute and just get some of your thoughts and hear some of your reactions. I want you to be brutally honest to me. I mean, I love the feedback. I love the challenges, and I love to be thought-provoking. That inspires me to do more and to do more research and to understand things a little bit better. So I'm just opening it up just for some thoughts right now. And Katie, I don't know if you have anything.
Derrick, I'm going to have you stop sharing your screen for just a minute, if you don't mind.
All right.
And then we can use the raise the hand feature for folks to be able to step into the space. In the meantime, so if you have some thoughts you want to share about any of the content from Derrick so far, go to your reactions button in your Zoom toolbar, and there is a button called raise hand. And that will tell me that you are interested in coming off of mute and sharing a thought, an idea, or a question. In the meantime, there was a couple of questions in the chat box. So we can start with those, Derrick. And one of them was, how can one move effectively from assimilation to biculturalism?
Great question. You know, assimilation is and what I love, I used to work with the Latino population in the greater Kansas City area, and we had a large influx of individuals from northern Mexico, and what I experienced there was I was working with a center called Mattie Rhodes, and they predominantly served the Latino population, the immigrant population, and they have a long-standing number of families who have been in the greater Kansas City area for years and generations, you know. And so you had this influx of those who had totally assimilated into society, and then those who were newer, more recent immigrants, and they had this bicultural. They held on to their language, they held on to their traditions and the morals. They lived in this culture, in American culture, but they also held on to them. So assimilation, when I think about that, is like, it is releasing a lot of who you are in your beliefs and your traditions, and you're adopting those of the mainstream culture that you're in. I think we should value the bicultural approach to where, you know, we also understand where we are, we accept where we are, but we also hold on to our traditions, we hold on to our native language and things like that. And so I think that, you know, really encouraging individuals, and celebrating those traditions, those values, those norms of different cultures helps people, really kind of look at assimilation in a different kind of way and embracing their biculturalism. So.
Another question is around the idea of power. And what do you see as the interplay between power and some of the concepts you were talking about around identity?
Yeah. Well, I think, power, what has happened is, from a historical perspective, I think that because of individuals, because of their ethnic identity and other things like that, the access and the ability to gain power, the ability to have to move into powerful roles and responsibilities has been impacted, and I think that kind of speaks to what I was talking about, the in group and the out group, and so those. I think, the way that I see power is that, we begin to understand that there is a thing called privilege in this country, and there's a thing that is very strong. It's called white privilege, and it doesn't mean that, your life has been made easier because of you are white. You have had challenges, and I'm sure you had to work for things, etc. But it does say that you have not had things be more difficult because of, your color. And that's where when I think about white privilege, that's how I define it. It's about power, it's about privilege. It's not saying that you didn't earn that, but it's saying that you haven't had barriers and obstacles placed before you because of that stuff. So it always interplays in that.
There's another question in here from Joy Trail. She said the idea of increased contact. And for folks who have limited experience outside their own group, we sometimes hear this in our office, and from folks from rural areas, where there's smaller populations, smaller opportunities for contact with folks who aren't part of your direct culture. What are your ideas on opening those doors?
Yeah, definitely challenges because, again, and I'm learning a lot more being in the state of Iowa, being in a state that has, small numbers of minority populations. In Missouri, it wasn't large. I mean, it was 11% minority population, 19%, Hispanic population, continuing to grow. But when you're in these communities that I'm learning and experiencing, it does make it a challenge to be. But I also encourage people to not think about differences only from an ethnic perspective, but also looking at it from a culture perspective and how people see. Because I think that there is diversity that is among us, but we don't dig deeper to seek understanding and to know what that difference is, because we already have preconceived, opinions about just the way people present based on, our beliefs and the social identity and how those things are developed and stuff. So.
And one more question, and I bet this is where you're headed in your talk, but how do we do the inner work and then translate that into our professional work?
Yeah. Well, I think what you guys have, scheduled for, this Sizzling summer session is really going to begin to address some of that stuff. It's, the inner work comes from just the self-analysis and to, I think, really trying to look at yourself and explore and see, the way that you have developed and formulated ideas and thoughts, how are they impacting others? I'm constantly doing that check. I'm constantly learning. I'm constantly finding that I have biases based on my experiences. As I talked to you earlier, I changed my formations, and I changed the way that I looked at how other people looked at me, and how I responded to how other people looked at me and treated me, based on just unpacking some of the things that I have experienced, and really kind of digging deeper in and analyzing, why do I believe in this way? Why do I think in this way? How did that happen? And then, is this in any kind of way, harming others? I think identity and the way that we treat identities, it is so powerful. In full disclosure, one of my identities is I'm a survivor. I lost a son who was 21 years old, and I think the major reason why, he took his life was because that he was not accepted in many different circles in which he wanted to be accepted in. And so the power of how we treat others and the impact that we have on others, I think we just have to continue to do, like I said, it's a journey. We have to always continue to search and find out, by the way that I'm presenting, is it harmful in any kind of way to others, or is there ways that I could be more respectful? I'm learning a lot about identities and the impact that it can have, and again, I have an experience that rocked my core, and made me respect, that the power that the way we treat people and the way we identify and the way we place people in categories has a profound impact on life. And so we have to begin to, again, do the self-work, always constantly examining, what am I doing? What am I saying? How am I presenting? How do we address these issues? And then figure out, is there a different way, a different path to do that? And then from an organizational perspective, a lot of that, I'll begin to start talking about the frameworks that are necessary in order for us to move forward and stuff. Yeah. I see a raised hand.
Permaline.
Lynn,
thank you.
Thank you. Thank you so much. It's Dr. Willis, right?
No, it's just Derrick.
Okay, I'm gonna call you Dr. Willis. But anyway, no, I want to say, first of all, thank you for sharing. This is something that's very powerful, and being so vulnerable. I love that you are showing us your heart, and that's reaching our heart. I sent it as a personal note to you, and now I can't find it. But in my undergrad studies, I was able to look into what Dr. R. Roosevelt Thomas posited, and I knew you knew about him, but he gave those 8 generic action items or options on how to deal with diversity components. And so all that you're talking about now is coming from how we are, how we identify, self-identification. And I loved it. You were all in what I do. But the social ecological model,
absolutely,
how everything impinges on us. But I am sharing it now in some of my new employee orientation classes. I have up arrows and down arrows. The down arrows is how society impinges on us. But then the up arrow is when I decided I was going to school with no college graduates, no home, just a love for education. And I began to influence up in that social ecological model, which is where I ran into R. Roosevelt Thomas's. And if you don't think it's too intrusive, may I share it with everyone? I sent it to you.
Absolutely.
Yeah. One of the things that organizations do is we may assimilate, we may isolate, we may suppress, a diversity component. So I'm just going to send that out there. And if you want to address it, you can. And I'm going to shut up because I'm also a preacher. So I'm going to shut up.
Thank you. Thank you for your comment. Thank you for allowing that. My next slide speaks on social ecological framework and the power of that. You know, it's not the individual. It's those circles of influence as well. You know, and that's how you bring about true change. Really. Yeah. For sure.
Thank you, Pamela, and Derrick. Head us into our final 15 minutes.
Yeah. Okay, I got 15 minutes left. Okay, so yeah, so in after having this discussion, you begin to say, okay, what is it that we can do about this? What do we need to do in terms of shifting the way we do our work? First of all, I'm a strong believer in, you know, the community-based participatory action stuff, you know, and it's like I never do any kind of work, I never do any kind of research without including the people that I'm researching, right? And so I'm just a strong believer in the fact that anything that I do, it is in partnership with individuals. And so that to me is the approach that we really need to take in order to begin to be responsive to systems and responsive to we're creating responsive systems and meeting the needs of all people and stuff. And as Pamela had mentioned, the social ecological framework, I think it's Bonner's work that really kind of began to start identifying it. And it has the individual, and then it has the family. You know, you can't influence change just from an individual, and then like we were talking about identities and how they are shaped, the family plays a role in that. And then the next layer is the community, then the next layer is policy and all that. And so in order to begin to bring about change, you have to have all of these things, as my friend Tawara Good says, has to be working congruently in a way where you're looking at policies, you're looking at procedures, you're looking at practices. You look at all of those types of things need to work together to bring about change. I mentioned predictive analytics because I think that it is something that I heard. I don't even know if it's an emerging trend or process and stuff, but I was in a training out in Baltimore, and I heard this individual out of Dallas speaking about how they were addressing a situation related to child abuse. And what they would do was they began to collect data, and they looked at where are all the most of the child abuse cases coming from. And so they was able to pull that down into zip code specific stuff. And when they looked at it, they began to say, okay, that these particular neighborhoods had high incidence of child abuse. And so what they began to do was then to dig deeper into those neighborhoods, just like I was saying, looking deeper into individuals as well, not trusting the eye. And so they began to dig deeper in there, and they found that there were certain conditions that were present in those communities that had these high rates of child abuse. They found out that there was high rates of incarceration, there was high rates of dropout, and there were high rates of renter and low rates of home ownership, all of these social things that were taking place in this particular community. And so once they identified these particular things, they can say that now, if we find other communities that begin to have these social constructs, so these social determinants that are significant in a particular area, we can almost predict that these things are going to start happening in those communities. And so that's how you predict, you align. Now what we can do is start aligning our resources to say, okay, if we know that these conditions are present in this particular community, let's pour information in about the importance of early childhood education, the importance of employment and bringing them opportunities for employment, the importance of, things related to bringing and building healthy children to prevent, child abuse. And so they started aligning their resources, and then started from a preventive approach. And so they predict, they align, and then they prevent these things from happening. So there's predictive analytics. And I have to say, Dr. Walkner introduced me to a gentleman here at the University of Iowa that's a biostatistician, and we had this conversation. I was so happy to talk to him about this because he does this kind of work. They look at data, they look at demographic stuff, and then they can begin, we can do this stuff from a science. They take individuals who enroll into the University of Iowa, and based on certain criteria, they can determine who's going to finish, who's likely to finish, and who's likely not to finish after 4 years of school. And so they can predict, they can align who's going to need help as they come in based on certain indicators, and then prevent them from dropping out. I mean, this stuff can be down to a science. And so I think we need to begin to adopt those kind of approaches more as well. You know, I love the work of you know, this whole health equity framework, and I really kind of pulled it off of the 10 essential public health services. I think it is on point. I mean, I think it is on point in terms of how we develop these equity frameworks. And I think the other thing, before I get into that a little bit, you know, and I'm trying to look at the time that I have here. I'll check here. But I think we have not done enough to define what is equity, you know, and what does equity mean. And I think a lot of times we're starting to work on these particular things, but we haven't defined what it means for our organization. What does it mean for our systems? What does it mean for, and when we speak it, because it means a lot of different things to others. You know, we spent many years talking about equality, right? And giving everything equal, everybody equal stuff. But we learned that that's not enough, because people start at so many different places, you know, and people are at so many different levels. And so how do you begin to develop that equity framework that meets people where they are and really begins to identify their needs and then makes adjustments? And so that's where the importance of assessment, you know, investigation, and really getting down to the root causes. You know, I mean, when you start thinking about, you know, when we're talking about identities and identity formation, and we're talking about, you know, in groups and out groups and all that social theories, I mean, that's where we begin to get at the root causes of differences and how differences are established and how people look at differences. And so, so the strong assessment and gaining understanding is so critical and important. And then it's not only, you know, once you are informed, you know, it's just like, what do you do after that? You know, it's like, once you identify, then it's like the development piece of it comes in. And then how do you create, you know, inform and educate others, but also how do you mobilize other people to be a part of the work? How do you create these community partnerships? We can't do this alone, right? I mean, one of the most powerful initiatives that I did was this initiative in Greater Kansas City, where I hired, you know, we called them promotores, but they were basically community liaisons. They are people who lived in the community, people who had respect and valued in the community, could influence others in the community and touch them in ways that we couldn't, because they didn't trust me. I didn't live in the community. I wasn't from them. I didn't speak their language. And so how do we mobilize and develop these partnerships and relationships that help us move systems forward? And again, that's what I call creating those champions that help us produce better outcomes. The other part is just the assurance part, you know, and I think a lot of times we underestimate this in terms of the organizational infrastructure, you know, having key people in key positions. You know, a lot of times we think that diversifying our workforce is the answer, but you know, I've seen organizations that had diversity out, you know, that was powerful, but you also have to look at, not only it's not diversifying your workforce is just the beginning of it. It's how do you retain individuals after you diversify them? How do you create opportunities for them to be in positions of power? I'm a person here. I lead a $6 million organization. I have 35 people work for me. The things that I can do and the things that I can say, I have executive power. I couldn't move a system. I couldn't focus on these types of issues when I was in a position that was not of power. Now I have that. And so it's not only diversifying it, and it's not only the skilled workforce, but it's also what do you do to create environments that give that opportunity for more voices to be at a table that produces this inequitable system and access to equitable opportunities and stuff. And so, and then also utilizing, evaluation, looking at your data, looking at your research, to just constantly trying to improve quality and having answers. The evaluation is not only, to see what is working well, but it's also to see what's not working well and what needs to be tweaked along the way. And so utilizing that data to give you a better understanding of how we can improve. And then the last thing I want to point out is just, just leadership itself. I know some of you might be familiar with Brene Brown's work, and when she talks about bravery and leadership, and how do we really create bravery as a result of this. And so, to me, brave leadership is embracing vulnerability, and it's not being afraid of being a part of this messy stuff that's in the middle, and not always having answers, but it's staying in that space for a while until things become clear, until your understanding is enhanced related to the things that are presented to you. It's less about who we are and more about how we behave. It's also creating a culture where people, again, are invited in. People are not only seen, they also are heard and respected. And we do a lot about, bringing people to the table, but I've been in situations where we bring the people to the table, but then we don't create this environment that makes them comfortable to even put their voices and have their voices heard. And then when they say something, we don't even respect what they say, And so how do you create this culture that really, is conducive for, positive things to happen, And then, I find out, when brave leadership exists, you care for people, and being connected, and being around the people we lead, and so when I took on this position, I said, I work for 35 people. People might say that they work for me, but now I work for you, and I care for you. I'm connected to you, and I want to know how you feel as the people that I am getting charged to lead and stuff. And so again, that's what I put forward for today. I hope some of the things that I said was helpful. I'm again such an honor to be a part of this series and be the one who gets the chance to kick it off. I think this identity development really kind of is the ideology, really kind of where things begin in terms of how things begin to grow beyond that and stuff. So again, Laura, thank you for your time, and thank you for the invite as well. So,
Thank you.
For your time.
Thank you so much, Derrick. This was such a fantastic session. You're getting all kinds of validation of that in the chat box right now. Earlier on, you might have seen a link that I've dropped in the chat box. You want to hear more from Derrick, you can check out the Midwestern Public Health Training Center podcast that he did earlier this year from January 2020, actually last year, entitled Tackling Equity, People with Disabilities. Thank you everyone for attending this Sizzling Summer Series Session 1. Join us again on June 24th at 1 p.m. for Session 2, Micro and Macro Aggressions and Implicit Bias. It will be a fantastic continuation of this conversation here today. Thank you again for completing the evaluation for the call. That will be coming to you sometime in the next 24 hours or so. We appreciate your feedback, and from all of us at the Midwestern Public Health Training Center, we will see you on June 24th. Take care, everybody. Thanks again, Derrick.